Yeah, we operationalized a workload staffing tool in our organization for one of our hospitals, and we're now in the process of, I'm sorry, for two of our hospitals, and we're in the process now of um, putting this into live production at the other hospitals. And it's really interesting because when you talk about the outcomes, the nurses at the other hospitals have heard about the outcomes and are really asking for this support. And I think this is, again, I said the issue of staffing is much more complicated than that saying, you've got, 20 uh, patients. We are at a 1-to-4 nurse-room ratio, so you get 5 nurses. It's much more complicated than that. And so, I think one of the factors is workload. So we have operationalized this workload tool. It is allowing us to take roughly 240 to 260 metrics out of the EMR, with over 80% of those metrics being nurse driven. So it's not always just simply the hemodynamics, the vital signs. It's not simply the diagnosis from the provider that plays into it, but a lot of it is the nursing work that we do, and it allows us to assign a score to how much work that nurse needs to put into that individual patient. The reason that this has become has become so supported by our nurses is because it has allowed our nurses to come into work every day and have the relatively same workload shift uh, over time. It doesn't change. So any nurse that's out there knows that there are times when you come into work and you have a good day. There are times when you go home and you have a really bad day, and you just feel exhausted. Well, we've been able to work with our nursing staff, develop what those workload scores are, and have really stabilized those individual shifts. So you may have a 1-to-4 ratio, but we may actually give this nurse a fifth patient because their workload is so much lower. And that nurse is okay with taking that fifth patient because I need my colleague over here to only have 3 patients because their workload is now consistent with where mine is, even though I've got 2 more patients. And the buy-in that we've been able to get from the staff has been unbelievable, because again, it allows us to get the right amount of nursing care to meet the needs of the patients that individual has. And we're leveraging, again, objective data to get that information forward.